All right, let's talk about something that's incredibly common, but for a lot of people, still a bit of a mystery: irritable bowel syndrome, or IBS. We're going to look at this as a journey, really, taking it from that initial confusion of just not feeling right, all the way to understanding what's going on and how to manage it. So let's dive in.
So, just how common are we talking? Well, take a look at this number. Somewhere between 10 and 20% of people are affected by IBS. Just think about that for a second. In any room with 10 people, there's a good chance that at least one or two of them are dealing with this, probably quietly, every single day. That's a huge number.
And what's really interesting is who it affects. The data is pretty clear. IBS is about twice as common in women as it is in men. It also tends to show up most often in adults who are, say, between 18 and 39 years old. Okay, so here's our game plan for today. First, we'll tackle the big question: what even is IBS? Then, we're going to break down the symptoms. After that, we'll walk through what the diagnosis journey actually looks like. And finally, we'll get to the good stuff: your own personal management toolkit to help you feel more in control. So let's get right to it. What exactly is IBS? It's one of those things a lot of people have heard of, but if you ask them to explain it, it gets a little fuzzy. Let's clear that up. The most important thing to get your head around is that IBS is a functional disorder. So what does that mean? It means the gut looks perfectly normal in tests, but it just doesn't work right. It's not a structural disease where you can see damage, like with Crohn's. And we know it's often kicked off or made worse by certain triggers. Stress is a huge one, and so are previous stomach bugs or gut infections. Okay, let's move on to the symptoms. How do doctors even start to figure this out? Well, to make it easier to remember, you can think of it as the ABC of IBS. Now, for a doctor to really start thinking it's IBS, these core symptoms usually need to have been around for a while. We're talking at least 6 months. And here they are. A is for abdominal pain. B is for bloating. And C is for a change in your bowel habits. It's a really simple way to organize what can feel like a whole mess of confusing symptoms. And if we dig a little deeper into that A for abdominal pain, there's a really specific pattern that doctors are listening for. The pain often gets worse after you eat something, and then it tends to get better after you go to the bathroom. That little detail, that's a huge clue for them. So what about the C, the change in bowel habits? What does that actually mean? Well, it's not just about going more or less often. It can be a whole mix of things: changes in the consistency or what it looks like, how often you go, and sometimes even seeing mucus. Now that we've got a handle on the symptoms, let's look at how a doctor actually makes the diagnosis. It's really not a single aha moment. It's more like a methodical investigation, piece by piece. The whole diagnostic path is basically a process of elimination. So first, the doctor confirms your symptoms have been hanging around for more than 6 months. Then they look for that ABC pattern we just talked about. And here's a critical step: they check for any red flags. If there are no red flags and the first batch of tests come back normal, that's when a diagnosis of IBS becomes very, very likely. Okay, now this is super important to understand. On the left, you've got your typical IBS symptoms. But on the right, these are what doctors call red flags. Things like unexplained weight loss or seen blood, these are not typical for IBS. If you have any of these, it tells your doctor they need to dig deeper and look for other, potentially more serious conditions. And part of that digging deeper involves a few key tests. Now, these aren't to diagnose IBS, but they're to rule other things out. So doctors will run some blood tests to check for things like anemia, celiac disease, or thyroid problems, because those can sometimes mimic IBS. They'll also do stool tests to look for hidden blood or signs of inflammation. It's all part of the detective work to make sure nothing else is going on. I want to take a second to talk about one test that can cause a lot of anxiety: the CA-125 blood test. It looks for a specific protein marker. But here's the crucial thing to remember: a high level does not automatically mean cancer. Not at all. It can be raised by lots of common, totally benign things, like endometriosis or even just your period. Okay, so once the diagnosis is confirmed, the whole journey shifts. It's no longer about finding out what's wrong. It becomes about taking back control. The focus turns to building your own personalized toolkit to help you feel better. Management really comes down to two main pillars. On one side, you've got lifestyle approaches, things you can do in your everyday life. And on the other, you've got medical approaches, which means using medications for specific symptoms. Honestly, the best plan usually involves a mix of both. So let's look at those non-medical tools. Stress management is huge, whether that's exercise, massage, or using an app like Headspace. Keeping a food diary can be a game changer for figuring out your own personal trigger foods. And then there's adjusting your fiber intake, and for some people, trying a low FODMAP diet, but that's something you really want to do with a dietitian. Now, on the medical side of the toolkit, the approach is very targeted. It is not a one-size-fits-all solution. The treatments are aimed directly at whatever your main symptom is, so whether it's cramping, constipation, or diarrhea. Doctors will start with what they call first-line options and then move on to second line if those don't do the trick. Now, you might have seen amitriptyline on that last slide and thought, wait a second, isn't that an antidepressant? And yeah, you're right, it is. But what's fascinating is that in very, very low doses, it works on the nerve endings in the gut and helps calm down those pain signals. It's a great example of how a drug for one thing can be used for something completely different. So as we've seen, managing IBS is all about building a personalized toolkit, a mix of lifestyle changes, diet adjustments, and targeted medication. This journey, from confusing symptoms to a custom-built management plan, is just a much more empowering way to approach it. Which leaves us with a final thought to chew on. Is this kind of personalized toolkit the future for how we manage all chronic conditions?